what we do is actually just a small element, but the whole idea of the project is to build relationships with our sort of counterparts and colleagues in Nepal, and to try and help with education training, and hence influence the healthcare of the really poor. And that's why our mission is to come out to rural areas where the really poor are, who usually don't have very good access to healthcare, and try and aim to help them.
Do you want to?
to give pain analgesia to the area that we're going to be operating on, so they do that through the spine.
It's chalk and cheese really. I'm in a tertiary hospital where we have whatever we want, we ask for and it comes. We've got diathermy, we've got people that have all worked in the roles they're working in for a long time, and everything runs like clockwork, whereas here everyone's learning to work in a new environment at the same time with limited resources and patients that have probably had longer before getting access to healthcare. But what I really think HPN is doing is the education to the Nepalese medical students and working with the surgeons over here for us to learn from them and for them to learn something from us. I think that that's what will make the longest lasting difference for everybody.
Eight, 9 years ago, this student charity, so a group of medical students formed this link with Nepal Medical College, and were hoping to do some philanthropic work out in Nepal. And they approached me to give them some guidance and join them on their first mission, and really that's where it started from, a small group of students and myself. And it's built up from there. Now we've got this amazing team of really multidisciplinary, ranging from medical students, nurses, pharmacists, physiotherapists, operation department assistants, anaesthetists and surgeons. It's become a very multifaceted project.
I knew HPN from the very beginning. HPN was established in around 2008 when I was a medical student. So this year there was a medical camp in the first week within the hospital premises here in Charikot, and we planned for the surgical camp in the second week, which is running this week. This is our third day. So we have so far done more than 20 cases. This year we have a public health teaching program as well for the health workers. We have been giving the training to the auxiliary nurse midwife regarding the reproductive rights and gender-based violence. So this is basically a 15 days package we are doing in 2 sessions. So this is our first session, and where it will be around 10 days. And also with the support of the Exodus Travels from London, we are celebrated International Days of Action for Women's Health, where we distributed freedom kit bags for the general health condition of the woman.
One more plus small. She's taken one underpant from the pack and is wearing the underpant. She first will wash her hands with the bar of soap. This is to reduce chance of infection.
So you can have one pair that you are wearing, one that is drying at home, and then one that is ready for use, which you can carry in your bag. Do you have any questions? Thank you so much for coming.
hydrocele repair is an operation, yes.
Some of these people, you know, they're seeing a doctor for the first time when they're in their 50s and 60s. So I think it's really humbling, the kind of work we do here. I think every year we've kind of created a family of people involved in HPN, and this is not just the people, the staff from the UK, but the students that we've kind of helped cultivate their training, and also the people of Nepal Medical College Teaching Hospital. So year on year our family gets bigger and we collaborate, we transfer skills, we teach each other things that we've learned, and that's what we're trying to make it more sustainable. That's our ethos, to be safe in rural areas and do what's necessary, but to create a legacy, basically, to provide teaching of skills that people can carry on and make things sustainable. And that's where I see Health Partnership Nepal going.
HPN has really evolved over the years. One of our visions is actually to find one health post that we can build a strong relationship with, along with Nepal Medical College, so that you can provide sustainable healthcare. So this way you can train the local doctors and other healthcare workers, and to build in that relationship so that they can become self-sufficient in that way. For example, if you go out to one of the smaller hospitals who do have some capacity to operate, but you can teach them how to do certain cases, then they may not need us to come again in the future once they're fully trained, or give them useful skills such as teach them how to use an ultrasound machine so they can make a diagnosis so they know how to refer on.
Because this area, after earthquake, we have lost so many patients, and so many people died, and so many people have different problems now, and people are very poor. So I think this is another area where this is going to provide free healthcare for them. So it's very nice from my perspective. Sometimes we might be like in our hospital, we are lacking some equipment, and since they are like HPN is giving some of the equipments which are very necessary for our hospital. In that case also, we are getting a lot of support for skill generations in our team. Lots of patients got benefits in the sense of free healthcare, and all of us, all the hospital team got good sense of skills in different techniques of pediatric surgery and also for adult surgery.